Okay, we are going to begin. We just needed to adjust the room a bit and get prepared for our next presentation. I'm Audrey Dowling with CDC ATSDR. And our next discussion is going to be on our CDC funding opportunities for tribes. Grants and cooperative agreements are mechanisms used to transfer federal resources in exchange for services to help fulfill CDC's mission and are direct benefit to the public. CDC's Office of Grant Services coordinates and oversees all funding provided through the various CDC mechanisms throughout the life cycle of the award. OGS staff is here to present on funding that CDC has provided to tribes, funding that is available to tribes, and some keys and tips for tribal communities and organizations that receive CDC funding. Today we have Terrence Perry and Shirley Bird that are going to present. Terrence Perry is the Office of Grant Services Director and Chief Grants Management Officer at CDC. He is responsible for the oversight of all grants and cooperative agreements, including quality assurance, compliance with rules and regulations, development of procedures. He has served in this position since 2013. Mr. Perry has over 35 years of federal service. Shirley Beard, is the branch chief for policy, risk, information, and systems management at CDC's Office of Grant Services. She has more than 30 years of federal services with over 20 in grants management. She has worked for CDC for 8.5 years in both grants, operations, and systems, data, performance management, policy, and workforce development. Let's welcome our CDC OGS members to present at this moment. And in the words of the movie Jerry Maguire, show me the money.
All right, so good morning, everyone. And first of all, thank you for allowing us to come and present at this. It's our goal to try to make sure that we're doing greater outreach, and especially to those underserved communities and tribal communities, just to make sure that they're aware that there are opportunities to apply for grants, and just to talk a little bit more about what we're doing and some of the things that are happening as well in the future. So as mentioned, I'm Terrence Perry and Shirley Bird is here. And yeah, if you have questions for us here, we'll answer them. If we need to give you a more detailed response, we'll make sure we get your information and we'll get back with you on that. And we're also available to be able to if you need to reach out to us as well later on. So with that, we're just going to go, as was mentioned here, just kind of give an introduction of some of the things that are happening at CDC, walking through what we've done, talk about a little bit of the process, as there's some things that have changed as we're moving forward to working with the department and with the program offices within CDC to try to make sure that we're making grants opportunities, as far as how the announcements are written, are much more easier to understand, read, and apply for, and some other things that some other useful tools that resources that are out there. So just as an overall, CDC right now has just under 6,000 active grants and we deal with just under 2,600 different recipients, whether they're state, CBO, the territories, tribal organizations, nonprofits. In this past year, we did with the staff, about 140 folks we processed over 14,000 actions that was either prior approval request or funding actions in the last year. We did about obligated just over $9 billion in total. And you'll see of that 9 billion, we did obligate. It's not necessarily a large amount, but it's about 75 million went to at least 75 different tribal organs or to 102 tribal organizations over this past year. You will talk about, we'll talk about some of the NOFOs that we've done that are specific to tribal organizations, but you'll find a good many of the notice of funding opportunities that we process or we post are open to tribal organizations to apply for as well. As I mentioned earlier, one of the things that we're trying to do is reduce how they are written from the standpoint that they can be rather convoluted or repetitive and redundant. So how do we make sure that they're easier to read? How do you understand that you are eligible to apply for it? Because I do know there are some concerns or questions as to, well, is that open to me to apply for? And in most instances, that is the case, but we're trying to make sure that confusion is lifted as we draft these documents. Here are some of the active funding opportunities that have been awarded over the last few years. Good health and wellness in Indian country, supporting tribal public health capacity in coronavirus, the tribal the TEPI NOFO that's out there. We have tribal practices for wellness in Indian country. So you'll see all these here and want to just point you to the bottom one is the strengthening public health systems and services in Indian country. That NOFO was posted earlier this year. Our plan is to award at least 25 awards by this September, obligating about $25 million will be the total the dollar amount that we're looking at, either through initial funding and then supplementing that by the September. But it's open to it was open to Alaska Natives and American Indian organizations. So you should start seeing if your organization, whether you received an award or not, we hope to have those all done within the next month or so. Just very quickly regarding some information, if you want, as far as a lot of tribal data, the numbers, how we've done, what we're doing, there's information on CDC's public website that you can find a lot of data, information, a lot of other resources regarding what we're doing from a tribal standpoint, how we're working with them in other areas. And one of the things I do want to just kind of point out that Paul mentioned yesterday, as you look at awards, don't necessarily just sort by what are those tribal awards, as I mentioned earlier, look at those awards that you're looking at to do that may have an impact or service or an activity that's important to you, that making sure that you can apply for those. Don't just take it from the standpoint if it's not necessarily targeted at tribes that you can't do it or it's not important to you. One of the things that we're also working within the department, as Shay's talked about with OTASA, is that we're trying to cross within CDC, making sure that if you're applying for one award and it may be an injury, but what's the impact potentially in environmental health, or so that we're working across or looking to work across offices to break down those silos so that if you're talking about an outcome, how do I make sure that that outcome, I can link everything together so I'm not doing siloed approach to it, so that if I'm reporting information on one, what's the impact of the other? How do I try to reduce administrative burden so I'm not necessarily generating multiple reports when it really leads to almost the same thing? How do I make sure that we're gathering and collecting information and that you're able to do what you need to do, but not necessarily do it in siloed fashions from the standpoint, yes, we're dealing with environmental factor, dealing with or injury, we're talking about dangers of some type of gas in a house. How am I doing that with taking surveys? Am I working together to make sure that I'm not necessarily having you respond to two different surveys if I get it all collapsed into one? So those are some areas that we're working on and the department is working on from the standpoint of driving towards reducing administrative burden, but also talking about equity. So how do we make sure that we're reaching beyond our traditional partners like the states and territories, but how do we make sure that we're reaching to those communities where it may make its way down, but we're not necessarily getting the information, or as was asked earlier, are there any brown sites in this area? Is it, or just because we've just never spent the time to really look there? So how do we do more of that? So I just wanted to make sure that as we talk about grants, do not overlook the fact that there's opportunities out there. You'll typically find, regardless of what government agency or department you deal with, there are three types of funding sources other than direct loans and things of that nature. Grants, which are primarily where we give you the money, you have outcomes based on that, and you perform to your grant to meet those outcomes. Cooperative agreements, which CDC primarily issues, but we're looking at that as well. That's where it requires substantial involvement, where there may be a greater need for technical assistance, where there are certain things that you may not necessarily have developed a capacity for, capability that we can provide to help you get to that point in answering and doing certain things. So certain phases where in a project and before you move on to the next one, and if you enter in certain types of agreements, typically not necessarily contract per se, but just straight contracts, but more consultant type work from that standpoint. Acquisition or just contracts themselves that may be awarded that necessarily they're not on the behalf of the government per se, or grants, as you say, are for public purposes. Contracts are for the benefit of the government itself. So we may say, I'm issuing you a contract for you to submit data to me for the purpose of the government collecting the data. In a grant, we're not necessarily doing that, or a cooperative agreement. You're collecting the data from a public health. We may ask you to share that data with us. So there's that big difference between a contract and a grant and cooperative agreement. But I did want to make sure I save more time for the standpoint of talking to some of the changes as we talk to NOFO development, the process for applying for grants, and Shirley will talk to that just to make sure that folks are taking advantage of that, making sure that your tribe is properly registered to be able to receive an award, that you have the right people in place, or I know Summer mentioned that she writes and does her own grants. We have other tribal organizations that may require assistance or hire folks to help them do that. But how do you make sure you're getting a very good product and for folks responding to the NOFO itself, and just guarding against the fact that we find that some of those organizations will share the same application with multiple recipient or applicants, so that it puts you in a difficult situation from the standpoint of as to whether we will make an award to you. Because if your application isn't necessarily tailored to your needs, but it reads the same as others, then we may not necessarily even accept those applications or review them. So it's just one of those things that we just need to make sure that you're aware of as you're preparing applications, or you're dealing with folks who will help you do that. How do you make sure that you're getting the best product to help you meet your needs as far as the goals that you want? So without further ado, I'll turn it over to Ms. Shirley Bird to kind of go into more of the intricacies of the process.
Good morning. Thank you for this time, and thank you for joining us. We're going to start off talking about the grants management life cycle. It's broken down into primarily 3 phases. Pre-award phase, where we're planning a program, we make an announcement, we receive applications, then we make awards, and then the post-award phase. Most of our NOFOs are 5 years, and in the post-award monitoring, and then the closeout of those awards. As Terrence mentioned, most of our funding is done through cooperative agreements. This means substantial involvement of CDC with you as the recipient. And this is some of the ways that we work with the recipients to ensure your success, because that is the primary goal, is that you be successful in your project, whatever that may be. It may involve conducting site visits. We evaluate progress reports. We do annual reporting. Some projects require more extensive reporting, but most of our projects are annual reporting. We ensure that you're complying with the requirements of the award, the federal requirements, and the terms and conditions of the award, because all federal money does come with strings. And we do closer monitoring of organizations that are determined to be high risk. What is your role and your responsibility as a recipient? Well, if you're going to receive federal funding, you have to ensure that you have the systems in place and the monitoring capabilities to ensure that you can properly handle federal funds. There's no check that comes in the mail. And you have to have the systems to be able to track the funds and allocate the funds accordingly. You have to be able to track your performance and submit timely reports. And you have to comply with the terms and conditions of your award. So now we're going to talk about some tips for applying. Your first stop is grants.gov. This is where most federal funding opportunities are posted. And this is a website that is open to the public and you can register. And when you get into grants.gov, you can search grants and you want to search for what's forecasted. That means what's coming in the future. The opportunity is not available now, but it may be available within the next 6 months, so you can get prepared, because you do have to get prepared before you actually apply for a federal award. And I'll get into that in just a moment. You do not want to wait until the day you want to apply to get prepared. And when you're searching the forecasted and the posted, there's an eligibility area. You can look for funding opportunities that are targeted to Native American and tribal organizations. However, I submit to you to also consider those that are open to all. Most federal funding is required to be competitive and open to all applicants. And as Terrence mentioned, the department is looking at our funding opportunities and streamlining those, making those more readable in plain language so that they're more accessible to everyone. So once you get to know grants.gov and you've explored and you've seen all of the exciting opportunities available or coming up, you want to register with SAM.gov. This is the System and Award Management System. You must register for this to apply for, receive any federal funding. And this process takes a while. So you do not want to wait until the day you're applying for funding to do your SAM registration. And in the recent months, there's been a significant delay in the registration process. So please allow at least 90 days to complete the registration process with SAM.gov. This is not managed by CDC. We have no control over it. We do have processes in place. If you're working on something, I can try to help you, but this is managed by the GSA. So start this process very early. The next thing that you want to do is any funding opportunity, you want to review it closely to understand what are the requirements for applying for this particular funding opportunity, because they do vary depending on the agency, depending on the program. So you want to make sure that you have a complete application prepared. If you go to our CDC website, we have information available to help in assisting on applying for a federal grant with CDC grant. And when I say grant, I mean grant or cooperative agreement. It includes tips for preparing your application. There's frequently asked questions. It helps you understand the review process, because once you submit your application, there's not going to be a response, next week. It takes several months to go through the various review processes prior to an award, except during COVID. We did some amazing things during COVID in getting funding out, but the normal process takes several months from the time that you actually apply to the funding decisions are made. The NOFO indicates what your requirement documents are, but pretty standard. You're going to require an SF-424, which is the application for federal funding, the 424A, which includes your budget information. You're going to need your budget and project narrative, where you break down what it is that you're doing and how much it's going to cost. And that's where you'll provide your details on that. Finally, there's a risk assessment questionnaire that's required for new applicants, and this is for us to determine what risk does your organization pose in managing federal funds? This will not preclude you from receiving funds, but it may require a bit more technical assistance and involvement from our office. Your program officer, your project officers, they manage technical assistance on the programmatic side. Our office provides technical assistance on the business side of the house. So you must be registered in grants.gov. So let's remind this that you have to be registered so you can upload your applications. And there are no extensions to no full application due date. If it says that the application is due on July 28th at 11:59 p.m., the system shuts down and the application cannot be submitted. In my 20 years of federal service, there's probably only a couple times that I've seen extensions granted due to tsunamis and things like that, acts of God that were beyond the recipient's control. And all applications must be submitted and accepted via grants.gov. Please, if you are applying for federal funding, do not wait until the last day to start submitting your application. We recommend at least 3 days prior to the closing date, but you do not want to wait until the last day that a funding opportunity is open to begin submitting your application. Because if there's a system glitch, if there's an error with one of your file types, it could preclude you from being able to actually finalize your application, because once you submit it, grants.gov does 2 layers of checks before it's actually sent over to CDC. So please do not wait until 11:59 p.m. to start submitting the application. What to expect? You received an award. Yay! We got the money. And you read that notice of award and it says you're hereby awarded X number of dollars, and you run down the street happy. But hold on. Make sure you read the entire notice of award, because as I mentioned, there are strings attached to these funds, and you need to know what those are, because you are legally bound to adhere to those terms and conditions. I highly recommend you go to the CDC grants page, look at the grants welcome package. It gives you a great overview of what you can expect. It has our general terms and conditions. It has the additional requirements. It talks about the reporting requirements, and it gives you will always have a grants management specialist and a grants management officer available to you for any questions, and there's listed on page 1 of the notice of award. But I highly recommend that you check out this website, get to know it, love it, bookmark it, because there's a lot of information available on this page. And here we have some useful resources for HHS, the HHS general grants information, our grants policy statement, the 45 CFR Part 75, which is our governing regulations. It's very important to know and understand these because you are bound to them when you receive federal funding from CDC. And then back to the CDC website, we have funding information available. We have the grants page, Grant Solutions, which is our system for grants management. And that is the system that you will work in post-award, the general terms and conditions, and then also our CDC budget guidelines that'll help you when you're preparing your budget. What information is needed? If you're wanting to purchase a vehicle using our funds, is that allowable? And what's required if you want to do that? This website will give you information that will help you to prepare an accurate and clean budget. This is our beautiful building, one of them. That's it. Okay. Any questions?
Hi, this is Corey from ATSDR. I find that many of our rural or tribal partners really struggle with two aspects of some of the grants that are available generally with all federal grants, in that number one, there sometimes is a minimum population requirement. And number two, a match. And I'm wondering, are there waivers or other suggestions you would have? And please don't say to partner with other areas or other tribes, because if they wanted to put one in together, they would.
Right.
And that's what, when we've asked this question before, just on a Region 7 standpoint, because we have the definition of a small community on the East Coast is very different than what a small community is here in the Midwest. We have communities of like 3,000 people or less, 300 people in a lot of small communities here. And a large city is like 50 to 75,000 people around here. That's what you all consider small. And when I say you all, I mean the entire federal
Right.
system. So do you have any suggestions for some of, especially these smaller tribes, on how they can get past either that match for funds or minimum population requirements?
So thank you for the question. And so two parts to it. So it's doing what you're doing right now is getting that feedback, because a lot of the programs will set that because of the fact they're looking at it based on what they believe the return on investment from the standpoint of if I put the dollars out there to these communities, will these communities be able to do this? What's the population that they're going to reach? Now, I will say that what you're raising is one of the reasons why, as I mentioned earlier, that the department and CDC were looking at going beyond our traditional partners and trying to reach those organizations or tribes or others that don't fit into that box that we typically have defined. But more of it is just really making sure that that's known and that's we're aware of that. So that we can make sure that we talk with program offices as they're developing their funding opportunity announcements. We don't particularly dictate that. It's what we can do based on feedback, talking with the program offices and how best to do that. And in some instances, when you talk to match, unless there is a federal requirement, there are some times that we can do that, or that there's those discussions as to how to do that. Many times that's driven based on the legislative language or the authorizing language for a particular program. But if it's not there, if it's just something that's been established by the program itself, yes, it's easy enough for that to be waived. And it's just a matter of asking those questions. Yes.
Thank you for your presentation again. I just have a couple of questions you may not be able to answer, but if not, just food for thought. There are many tribes throughout the country that have very limited or poor access to internet capabilities, which would in turn impact them to be able to submit a grant application. So when looking at equity issues such as that, what are we doing to take into account or for those types of issues? There may be some tribes that are able to apply, but because of the constraints around internet access, may have some difficulties in doing so.
So just to address that from the standpoint, as Shirley mentioned, typically the process is to accept the application through the system. There, but you'll also see in every notice funding opportunity, there's also language that says if there are certain glitches or certain things that you don't have, that there is a means for us to accept them electronically. The bigger issue that you have is that if you can't necessarily submit it in the system, or you don't have access to reading it, you maybe actually don't even know that it exists to apply for it. So that's really kind of the bigger issue, is that you may not even know that you can apply for it, more so than the ability to get information in. So how do we make sure that information is shared? And that's part of one of the reasons why we're here now today as well. This is just to make sure for folks to know that if and when you can, make sure that for those who that you can pair up to get that information, and you're talking through either through program offices or through other work groups or committees that they're seeing this, or is that information being shared across tribes, across regions and things of that nature, or as was mentioned from a forecasted information, I'll use the Department of HHS as an example. we are required to submit all of our forecasted information by August 31st. So all the awards that we're planning for that next fiscal year, there may be those occasions where there's something that comes up and we add to it,
Mhm.
but we have to publish them all by August 31st so that folks will see those particular announcements at that time in the time frame. So that's the kind of information that we hope that folks are sharing amongst each other to be able to say, hey, this is of interest for us, but this might be of interest to you as well, and being able to communicate that. So we'll do what we can, and as far as getting out there, and which is part of the reason why we're here now, just saying, hey, make sure that you're registered, that you're looking at your system of award management, where you're looking at it to make sure that you can apply for grants, that you're keeping that information up to date. We'll find that folks have done it once, but they let their registration lapse, and it's been a kind of an issue lately to get that updated to make sure that you can apply for awards.
Okay.
Yes.
Then the second question I had was, I'm just curious in terms of the statistics, looking at the number of awards that are announced every year or within a certain time period that tribal communities or indigenous populations are able to apply for. How many, what would you say the percentage is of those not eligible? I don't want to look at eligibility, but are you seeing an increase in number of tribal communities applying for cooperative agreements or grants or NOFOs? And if not, is there a way to find out what the barriers are or reasons why that they may not be applying for?
So I would say over the last 4 years, we've actually seen an increase. CDC and HHS are making a much more concerted effort to award to tribal organizations or Alaska Native, so that there is an emphasis in doing more. So as once again, especially as we're talking about equity, so we hope to start seeing more of that here in the near future. And as I mentioned, getting away from just awarding to what we call our traditional partners, and being able to, I know that over the years, it's always been an issue that as I've come to different meetings, that we don't want money to come from the state to us. We like to have the awards made direct to us. And so that's part of the emphasis in trying to make sure that that's happening. I would say historically, yes, our numbers have been low because that's really been the model that's been followed is go through the states or pairing or partnering with IHS and working in that way. So CDC is looking more to try to do more directly, and as even more so as why Shay mentioned that OTASA has been established to try to make sure that there is a much more of a focused and direct and intentional means of looking at tribal organizations.
And then my last question, I promise, is I know a lot of times reporting requirements serve as a huge burden for our tribes and other Native American communities or indigenous populations. And it's actually pigging summer.
Mhm.
If I heard you correctly during your presentation, you said that your award that you received had little to no reporting requirements. Can you share more about that award and how other communities may be able to apply for that if they're not aware of it? I was gonna bring it to you, but.
So that award was a U.S. Fish and Wildlife Service award. It was very small. It would not be on the order of like a CDC award or even anything we get from EPA. And I will tell you, you mentioned grants going through the state. That grant actually went through the state of Oklahoma, and now we are having problems getting it to the tribe because of our governor. So that is not something that works real well in Oklahoma at the moment. So I guess just kind of consider that. But yes, there were very few reporting requirements on it. It is it's very easy, small, easy grant to apply for, and I'd be more than happy to share the information if anybody wants it. But it is out of the ordinary from the rest of my cooperative agreements, who sometimes have 200,000 page final reports.
And so
Thank
just
you.
to kind of just to address from an administrative burden, that is another area that, as I mentioned earlier, that the federal government supposedly we're all working on, but CDC as well, as to how do we make sure we're asking for those reports that are required, not necessarily those things that are preferential, not adding those things, and really asking the question, what are we doing with the data and those reports we collect? How are we actually using them? And so that's those things that we're asking programs to think about as well as they're developing their NOFOs. What are you actually going to do with the information? Is it truly valuable? And how are you using it, that information that's collected, to shape and form the next announcement or funding announcement that goes out? So we're doing those things. One of the things I did not mention earlier that I know this kind of gets into, not necessarily from an advisory committee perspective, but once you work through a grant and you're coming to the end of it, your feedback is also helpful for those of us as we're working with folks to develop and write them. Because if there are things in there that you think you're asking, well, why did you ask us to do this, or this was no value? We need to know that, because you'll find that, as was mentioned earlier, there was someone talked about, we'll do an award and it may go on for 30 years. And we're going to put it out the same way because we believe that's information we collected or how we've collected it. But if you have more creative or innovative ways of doing things or thinking should be done, we need to share that information. And that's kind of the goal, where we're also trying to shift from grants and cooperative agreements from being prescriptive in nature, but being much more outcome driven. Here are the outcomes that we expect to see. I need you to really tell me how you're going to do that, and then really measuring you and tracking you on that instead of just having you generate reports. Yes.
Yeah, I think you're mentioning the 30-year-old program or 35-year-old program is what I mentioned, because that's the cooperative agreement that we've been running for 35 years. So, so yeah, I would like to make a comment from program point of view. As I mentioned in my presentation, our office has several large cooperative agreement program. And in the last few years, we've been actively trying to bring tribe into our capacity building cooperative agreement, particularly with the recent cycle that we just started a couple months ago for the next 5-year cycle. We were very excited during the pre-application phase. There was one of the tribes submitting an interest letter. So we were like, woohoo, yeah, we finally were able to bring, in addition to building capacity at the state health department, where we may be able to bring tribal partner into the picture and help them. But eventually we didn't receive any application from the tribe. And from the feedback that the program received from the partners, I think we all have the same feeling that the application process, not only the reporting is very complicated, but the application process is very complicated. I will look at the whole package. I was like, oh my gosh, if it's a tribal with a limited resource, how can they navigate registration here, registration there, prepare A, B, C, D, E form, and in addition to the big narrative and that they have to prepare and technical things. So one thing that we get a question is, how can they get help in helping in writing the grants or applying for grants? And we as a program, we're not allowed to help anyone, as you know, we'll be violating the law. So we don't have an answer for that. So my question for you, or maybe for Shay, is there a place, let's say at CDC, who can provide assistance to tribes who are wanting to apply for grant, but don't have the resource, don't have the experience, expertise on writing grants? I
Right.
think that would be something the program would really want to have as well, since we cannot help them, right?
Right. So a couple of things I'll say that we've seen where we've actually had some greater success from tribes applying for things is that, for instance, we'll talk about a NOFA that we're going to put out, and we will hold a pre-award type conference and where we can answer those questions that we provide upfront, this type of information to say, here's what you want to make sure you're looking for, here's what you're wanting to do from that standpoint. So there's ways of providing some technical assistance prior to award, but the key is that you're making it open to all who want to participate, not necessarily targeting. So that's how you ensure that you're not favoring specific organizations or before they apply. So there are means of doing that. And that's part of the reason why I mentioned that while we're here today. Didn't even mean to insult folks who've been applying for grants for years, but part of it is just making sure that there are these tools that are out there for those who have not done it, or that, as I mentioned before, that they may rely on a contractor to perform those activities for them. But if they really don't know what the tribal or the Alaska Native organization's capacity to be able to perform those capabilities, you don't want to put yourself or your organization in a difficult situation when you can't perform or you're in that position where we're now talking with you about putting you under corrective action. You want to make sure that we avoid that, because our sole purpose of putting the dollars to you is from a public health perspective, is that in the end, that you are successful and that your success is everyone's success, because whatever we do in improving public health has a positive impact for all of us. Yes.
Yeah, I mean, I understand. Yeah, we do all of those, right? We have the pre-award meeting to open up to everyone, to give them, what's expected, what's required. I mean, all of this, we know, we're very aware that you cannot, you have to open all, so everyone has equal opportunity. We're also aware some of the other states are very resourceful. So their grant proposal is beautiful. It's a textbook, but some of the other states and definitely, tribal, they have very much limited experience and resource to write like that. I think a lot of our grants, some of the grants are to help them doing the work. So maybe they have a hard time writing the grants to apply, but it doesn't mean that they cannot do the work of getting the grant.
Correct.
So my specific question is, something to think about is, I think it would be nice to have it, let's say, a hotline that people can call in, asking general question about one grants, all grants in overall, since we cannot provide that kind of service, but just some kind of for service that someone, as I said, either at, maybe not at OGS, but maybe at OTASA. Is Shay here?
Yeah.
Okay. Yeah, who can help them help them through the general question. That's what because we have this, we are facing that challenge. So
And as you said, there are some means of doing that, but the key is if we have that, if it's not well known, then we're not doing it well. So that's the issue, because there are points of contacts and things that can be done, but if there are struggles with that, that means that we're not communicating it well. And so we'll take it to go back to look at how we can better do that, to make sure that folks have access to be able to ask those questions and things of that nature. So that's we'll make a note of that. Yes, sir.
Hey, thank you for the presentation. It's a great takeaway. Specific question, getting back to Navajo. So let me give you a little background about Navajo Nation. It's a huge area. So there's the mother government, which is in Window Rock. And so I go around to the local communities. There are 110 what we call chapters, which are sub-political units to the mother government. And a lot of criticism are coming from these local communities where they want to participate in grant writing. They want to submit an application. But here's the thing, getting back to the knowledge and the wherewithal of grant writing is one issue. But here's the question specifically. Has CDC awarded any one of these local 110 chapters what we call certified chapters? So since 1989, Navajo government has been promoting decentralization and giving more authorities to their sub-political units, Chinle, Tuba City, Kayenta, Delcon, all across Navajo. 45 of them are now certified. They are more autonomous, and Kayenta, for an example, was a pilot project, but now they're a township qualified, something to the equivalent of a municipal government. But my specific question is, has CDC awarded any one of these chapters?
I will have to go back and take a look at it. So I don't know for sure, but what I would say that from the standpoint is to how they may have applied, because it also comes back to, for many instances, when you'll read the award, it talks to, typically it'll say federally recognized tribe or organization or whatever. So it has to make sure that if you're not one of those, if you're not, even though they may have been certified that way, are they considered, at what level are they considered a recognized tribe? So that could be part of that issue, but we can go back and check to see, but I quite honestly can't tell you that I know that we've done it to one of the certified local tribes, but we can go back and take a look at that. But as I said, what you're going to look at is, are they registered from SAM to apply for an award as a separate entity from Navajo, the Navajo Nation?
Right. Okay. Well, I guess the USD, I know this, the USDA has made a grant available to Chinle government, Chinle chapter. So I can answer that question, at least on my own, but I was just wondering about the CDC, if they've ever.
I'm not specifically aware. We can go back and look at who we've made awards to. So, and we'll get back with you on
Thank
that.
you.
So
Mm.
want to make sure I do get your contact information.
Hello, so in the presentation, you said that all of those that want to apply for CDC or federal grants, they can go to grants.gov. Are there any other ways in which they could learn about the grants that are offered? Is there some other way? Is it distributed through other channels so that tribes or other organizations, I don't know, OTASA or somewhere, so that tribes and other organizations can learn about the actual grants that are open and available?
And there are those instances where certain offices will post that information themselves on their internet site. I know others will mail them out to using tribal organizations that they'll have a listserv that they will send them to. But from a formal requirement by law, we are all required to use grants.gov. That is the primary source where, if you're going to apply, if you want to find it, that's where you go. One of the great things about grants.gov as well is that if you just kind of limit yourself and you say, I only want it for those that are open to Alaska Native, American Indian, or whatever, you're only going to get those. But if you can set up your search to do that, but you can also set up your search to talk about water or injury prevention or environmental health, and any award that has any of those keywords in them, whether it's through EPA, through HUD, or through CDC, you'll get that information. It'll send you a notification of those awards that are those announcements that are out there. So as you do that, you want to make sure that you're looking based on the needs of your tribal organization, that are there. Set it up so that you're getting those notifications for that to come in. As I mentioned, it just really depends on the user word, depends on the organization as to, or the department as to how they publish that information. Most folks typically don't necessarily get sideways of that because they want to make sure that folks are going to the primary source. Yes.
So thank you both very much. I have worked with these two individuals and they are almost crystal ball magic, right? But one of the things that Mr. Perry is talking about, I had to set up my own grants.gov and do keyword searches, right? And I'm not so good about that, but you check all these different boxes. And then I started getting emails because as the Office of Tribal Affairs and Strategic Alliances, even though we are the point of contact for all of CDC regarding Indian country, we often don't know what those funding are going to come out. Now, that's crazy. I see everybody's nodding their head how crazy that is. But that grants.gov, set up click every darn box, and then you'll start getting those email aware. And then you can go back into your own profile and say, okay, I no longer want to receive these, unclick the box, right? A couple things that were mentioned about the matching funds in OTASA in my short detail, which ends on September 9th. One of the things that we are very close to is changing the template for NOFOs. One, we are addressing the match issue, trying to get a waiver for tribes so that, and that's a whole thing unto itself, right? But there is a government to government relationship. There is a responsibility. So when we hear Mr. D from Dene talk about how USAID did it, That's a key because now we can reach over to USDA and say, how'd you do it? Because we're all working under the same guidelines to a big extent, not exactly, but there's that. The other part that we are changing in the NOFO and the template, which we are just a smidge away from getting signed off. Walensky was about to sign off and then she left. So now I'm like, all right. However, it's the fact that sometimes our NOFOs require tribes to get a letter of support from their states. And I'm like, oh, no, you can fill in that with whatever word you like, right? But those are some of the things that we are trying to evolve to, right? Those hearing your feedback, as Terrence mentioned, we really do appreciate it. We need your feedback so we can internally be your advocates. We're not aware in our day-to-day when something's going on in Indian country until somebody will call. The other thing is tribal support at cdc.gov. Email tribal support at cdc.gov and ask to be added to our newsletter distribution. We often will find out, even from our other federal partners within HHS, sometimes even outside of HHS, of funding opportunities. So we include all of that stuff in our newsletter, tribal support at cdc.gov. I think that's like the 20th time, so I'm good on that, right? Yeah, 11 times yesterday and another 100 times today, but I think we all have that. The other thing that when Ms. Bird was talking about the system on how you apply, about that SAMS, and I don't even, that's a whole nother acronym besides my cousin's first name, right? It's a system that she was talking about that could take 90 days. You don't have to redo that for each one, but you have to be registered in the system. So let me emphasize what she was talking about is spread the word to all our relatives. Go in and register in SAMS, because when you get your email notification, then you're already, that part is done. It stays there. You don't have to redo it each and every time, but that's the first step. So once you have SAMS set up and then you get your grants.gov notification, you go, here's an application that we want to apply for. That SAMS is not going to hold you up. So really want to underscore and thank Ms. Bird for really putting that out there. We've talked a little bit, we've heard a little bit about the need for technical assistance in writing grants. So I have made a note that I'm going to reach out to several of our partners, Administration for Native Americans, HRSA, and ask for their trainings, because they do already trainings on how to apply for federal grants. So I don't need to start from a blank piece of paper, right? There's a little nuances for CDC, and I think that what we can do is build upon that. And much like in the federal government where we have turnover of staff, there is enormous amount of turnover of staff out in the communities, oftentimes when tribal elections occur. So given that, I am committing to you, look at me, I am committing to you, all of you, that I will move forward with getting a training in place with our help from our CDC folks based upon others. And we may not even have to tweak some of the others like HRSA, SAMHSA, because it's the same kind of system. But if there's something in particular for CDC, we will add to that. We will record it. We will ensure that it is available so that when you hire new employees, or you sometimes have the luxury, and it is a luxury, to contract with a grant writer, or you're training your own because we want to grow our own, that recording will be available. And if there somehow is a change in the way that we process our applications or requirements, we will update that training. That is a commitment I make to each and every one of you in this room and online. Thank you again, Terrence. It's always been good working with you and Shirley. These are two incredibly knowledgeable people. And if they don't have the answer, I can attest personally that they will dig and dig in to find the answer. They are good partners, as well as our contacts in our regions, whether they be the HHS Regional Director's Office or the ATSDR. Make our contacts. In Indian country, it's all about relationships. Work with your states. Work with our presenters. Thank you both so very much.
Question behind you. One more question.
So the last time I came up to this podium, I kind of walked away like, oh no, I guess I asked a question that nobody was ready to answer. So I'm not going to ask a question this time. I'm just going to make a statement. So I'm a citizen of Cherokee Nation. I was raised by my great-grandfather. I grew up with my great-grandfather. He was a first language Cherokee speaker, and he would always tell me, honey, the water that you drink is medicine. The air that you breathe is medicine. The food that you eat is medicine. When I was little, I didn't quite understand that. But now that I'm a woman and I'm a mother and I'm a leader, it all makes sense. The air that we're breathing, the water that we're drinking, the food that we're eating, those all tie into the social determinants of health. Where we eat, where we sleep, where we play, where we work, all of that. Tribes have been practicing public health and wellness since time immemorial. We know how to serve our communities and how to do it in a meaningful way. What I've been seeing across Indian country is that there is a colonialized way of how to implement public health in our communities. From my standpoint, we need to be able to decolonize that process and allow tribes to implement public health programs that fit their tribes and their communities in their own way, without this perception of, the government's idea of what public health should look like in Indian country. The other thing that I would just like to point out is that there's a lot of money. I'm sure there is a lot of money that is left on the table every single year that tribes did not use. That should be an indicator that there is something wrong. Something is wrong, because we're not going to just leave money. And I know that there's the piece of like the matching piece, but that really isn't the main piece. For us, we wear multiple hats. You might be on council and working in the public health office and doing security if you're coming from a small tribe. So how is it that somebody who's wearing all of those hats in all of those different sections are going to be able to apply for this grant and then manage the report out for the grant? Because let's be real, like that is what takes a lot of work, is reporting out. So there needs to be some kind of program or something in place that would help to alleviate some of that report out. And maybe it means that there's some additional funding in there to support a public health officer, that is their role. Their role is to apply for grants to strengthen our capacity, our capabilities, and to do the report outs. So that's all I have. Wado, thank you.
Well, thank you. And your comments, we appreciate your feedback from the standpoint of understanding it, as I mentioned, about trying to reduce the administrative burden from that standpoint, and shifting, as I also mentioned, shifting away from being prescriptive and telling you how to do it, but more in talking about what are the outcomes, so that it gives communities the greater flexibility to be able to say, this is how it best fits. Now, of course, the funding itself, depending on the source of the funding, may have its limitations based on how it was the authorizing, excuse me, how it was appropriated and authorized to be able to be used. But there are some means that we, yes, our goal is working with programs to try to minimize that, to give that greater flexibility so that we understand that one size doesn't necessarily fit all. There may be those programs where that there is a reason for that, but it is, yes, taking in community feedback and getting that. And that's once again, that's why we're here. We're asking you for your feedback. And my comment earlier regarding how a NOFA was written and it's coming to an end, we don't necessarily know that it wasn't effective for you if you don't let us know. We may be looking at a different set of numbers in a different perspective and coming to a different set of conclusions based on that. And so that's why your feedback is important. Yes.
Appreciate that comment. Really took that to heart. Hopefully we're taking notes. I know in CHATSR, I know the grants folks are listening. I know ATASA is listening as well. I want to thank you to Terrence and Shirley for your presentations. Just to note, and I thought I'd been around a long time. Terrence, I'm celebrating my 34th year in January, but Audrey introduced you as having 35 plus. What do you mean? You must have started when you were 2. I started when I was 5. And so we've both been around a long time. I know when I started almost 34 years ago, you know, we're talking about NOFOs, we're talking about contracts, we're talking about grants. And it's taken almost 35 years or 34 years from then to now, as you just spoke about, how can we make it easier for tribes and others to apply to this grant? My specialty is environmental justice, health equity, trying to make sure that, again, those that have been disproportionately affected, not only with environmental health reasons or health equity reasons or whatever it is, but sort of been left behind. In some instances, how can we make things better? And that's a start, making things easier for us to apply to. We still got a long ways to go, but I think we're making a little bit of progress. It's probably taken 30 plus years, but we're making progress. You guys mentioned the NOFOs, the grants, and the contracts. One of the things that I've been embarking upon, particularly with my HHS hat on, and haven't heard a lot about it at CDC, is the challenge process. Are we engaged in that in, I would go and say, a significant way, if you will, where, again, it's more than just having prescriptive as to, you know, being able to, sort of money goes to local governments or state governments or whatever. It's actually community-led solutions to really address those issues that they see fit and they, as was just mentioned, that are good for their communities, if you will. And I was just wondering that as a question, how engaged have we been? Are we engaged? And what's on the horizon in that area? So that's my question.
So those questions have been asked and raised, and part of it, and I'll just put it from the standpoint of it's really of a culture shift from a lot of the agencies and departments or and CDC as to how we view that and look at that. And so there has been discussion on that because, as I mentioned earlier, how are we now, and that was part of the discussion when the new center, the public health infrastructure was stood up, was to have some of that broader discussion as to how do we get to those communities and those areas that we haven't gone, we've not necessarily dealt with in the past or directly. And so how do we make sure we flow down those dollars to that? We saw that as part of in some of our NOFOs for COVID, when we had that, we put out, we're very specific in language to say, make sure X percentage of the dollars made it into rural areas and made sure that was defined, made sure or tribal organizations got money, how it flowed down to make sure that was very intentional to do that. Part of it is now, as you mentioned, is to how are we looking at that and how are we writing our grants to target those areas so that we are making sure money is going to tribes, to underserved communities. There's some limitations as to how that's done, but it is an approach, and that's part of those questions. And part of it has to go back to the data we're collecting. Are we seeing data in those areas? And right now, if it's not there, then what's the other part of the question? Well, how are we making sure that we're affecting these groups? And based on the money, and this also gets back to, I'll use the term return on investment. If we've been funding a project for 20 years or 30 years, have we seen an exponential growth in, or are we at that point where the return is going to be the same? Or is it time for us to do business differently? And so, and measuring that, and once again, focusing more on outcomes. What would you like to see? A 20% reduction in this area, but instead of us saying, we want you to do X by testing 35 people a day. Okay, what does that do for you? What are you using that data for? Instead of maybe talking about, I need you to, and being very prescriptive into the areas you do it. Can I target an area that I have 80% of a disease factor and I see a 40% reduction in it? Makes a bigger difference than me hitting everyone across the board. So that's part of that. It's really from a program's perspective, are we changing our way as to how we view and how we operate and conduct business? And when we talk to our expectations, and that's really more of a programmatic aspect of it. But we're asking those questions because from a grant standpoint, that's what we're being asked as well. Are the dollars we're putting out the door, are they making a difference to the public? Well, with that, then my apologies. I think I went well over time, so my apologies. We are here. Our intent is as there are several other of these that are occurring that we're going to try to participate in because we feel it's important for us to be there to make sure that we're communicating with as many tribal organizations and just making ourselves available. We do have some post-award type training that we can provide and some other things that we can do. So once again, our goal is to make sure that you're successful so that we are all successful and healthy. So thank you all and appreciate the opportunity to speak here.
Okay, we are almost at the end of the day for a very exciting session coming up, the discussion session. But before we do that, I have one announcement I would like to make. If I can ask the AV guys to pull the one slide up. Thank you. The National Center for Environmental Health and Agency for Toxic Substances and Disease Registry, we're working with ASTO. And so we're looking for, we want to hear from tribal members, tribal communities as it relates to unusual patterns of cancer. So we do know that we've heard a lot recently from tribal communities about cancer clusters that they're experiencing in their communities. So we would like to hear more about what tribal communities are experiencing in order to help us develop materials and other information that may be able to help. So if you would like to participate, and this is around our recently released 2022 guidelines for examining unusual patterns of cancers and environmental concerns. And so the people that we're working with, it is Kathy Dolan with ASTO. And so her email address is on here. And then in our office in NCH, John Quill Dent. And John Quill's email address is on here as well. So if you know of any tribal members that are interested in participating, we would love to hear from you. Please reach out to either Kathy Dolan at kdolan@asto.org or John Quill Dent at jdent@cdc.gov. And with that said, I'm going to turn it over to my colleague, Shay, who is going to facilitate our discussion session and get some enriched conversation going on that we may not have had a chance to have during yesterday or today. What do you need some help with?
Thank you very much. Thank you, little Elvis there. Thank you very much. So we're going to go into our a circle. So please join us here in a circle. We have 2 handheld mics. We're going to pass those around. We're just going to have an open discussion. So I'm going to hit mute, I think, on this one. Please join us in the circle. Thank you. Brett, will you, since you're by that door, will you let the folks outside know that we're starting our circle? Thank you, sir. Caught you right at the right time. Ah, sister, you got a sister right behind you. It's always good to have sisters behind you. Come on into our circle. Just sit next to me and just elbow me. So thank you all very much, especially staying for the last day, right? That's always a difficult thing. So what I'd like to do is just, there's a mic right there. We're just gonna pass the mic, much like in our traditional ways of, and if you have nothing to say, then, we just keep circling, right? That's how it goes. Before we get to there, though, I would like to take a moment to give thanks to Creator. Join me, please. Creator, thank you so much for the opportunities of today, keeping our ears open to things that we've heard that may change our minds, our perspectives, our opportunities. I want to thank everyone who attended yesterday, today. Hope that everyone has safe travels home and that they find their loved ones healthy and in the same condition of good way when they do return home. Creator, we ask that you watch over those of us who are traveling today and tomorrow and into the future as we attend meetings determined to help our people, help all people. For you have given us the responsibility because of the knowledge, because of the drive, because of what you have put in our hearts. We ask that you watch over our family members, our relatives of all races who are struggling in all kinds of different ways. We thank the presenters for sharing their knowledge. We are a humble people. All things are equal because we are all your creations. Thank you for the guest speakers, for everyone who helped in organizing and planning. We look forward to what you put on our path. Thank you, Creator. Hi, hi. So pick a seat, any seat. So this is really just kind of what has been your impression here? How could, what have you, what are your takeaways? How do you think we could be better? Anything else you want to say or you didn't want to say and now you're going to say, because this is safe space. This is safe space right here. Let me ask our AV guys, thank you so very much. Will you turn the camera off? So we will conclude the live stream now. Thank you all who are online for joining us, and this will conclude the live stream.